Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great video of how to strengthen your neck muscles using a resistance band to help with cervical degenerative disc disease. Hope you enjoy. So there are a lot of exercises out there to help strengthen the neck. But if you have cervical degenerative disc disease, you need to keep in mind certain postural traits that are going to aggravate those discs. And you need to keep those in mind while you're exercising. Today we're going to go over a great exercise for lateral flexion, which is side tilting of the head, and rotation and twisting the head, noting a head retraction or a pullback maneuver. In cervical degenerative disc disease, many times a forward slumped posture increases the flexion effect or the bending forward effect on those discs. The discs sit in the front of the spine, so as we flex the lower neck with slumped posture, those discs become compressed. That's the major irritating motion or direction of motion that's going to irritate most disc problems. So to decrease that flexion or that compression load on the discs of the lower neck, we want to try to keep the head pulled back and the shoulders pulled back so that the front of my shoulders are square and my ear is on top of my shoulder. That's good normal posture. As the ear travels forward, it prevents the facet joints from absorbing as much compressive force and places more compressive force on the disc in the neck. So what we're going to do is we're going to take a resistance band, and you could use a light band at the beginning or a power band eventually, and we're going to rotate that band so that we open it up and place it against the back of our head. You want to make sure that the band is not too low so it doesn't create an extension or leaning backwards on the head, or too high where it's going to slip off the top of your head. You want it just above the ears. You're going to back up until you have the slack pulled out of the band, and you're going to set your shoulders in a square alignment, and any other shoulder blade or neck positional traits that you have in terms of distortion you want to correct. If you typically have a problem where if you look at your posture and you lean more to one side, that's going to compress the disc and the joint and the nerve on one side, overstretch on another. If you have a tendency to turn one way more than another with your daily habits, you look in the mirror, your friend looks at your posture, and you notice you actually have a little bit of a rotation or turn to one side of your neck, you're going to have an asymmetrical postural application of force on those cervical discs. The trapezius and the SCM muscles are going to be set in different tensions from right to left. So you want to make sure that you're in a neutral or square position. If you're not sure what your normal posture is, either of your shoulder blade or of your head and neck, go to the Posturesize or PainFreeAndFit.com website. We've got a great body analysis there that's free. You can check yourself out and learn what your unique RPI or reverse posture isometric is, so you can hold your shoulder blades and neck in the right way. If you're doing these exercises and you don't have your shoulder blades in the correct way, many times you're going to be strengthening the dysfunctional aspect, meaning going to your strengths of leaning your head one way or elevating or tipping or rounding or winging your shoulder blade, and that's going to just strengthen the muscles to pull you into abnormal posture and put more pressure on those discs. So you really want to learn what neutral neck spine position is or what your correct RPI position is. So once you get that set, we're going to take that band, put it around the back of our head above our ears, back up so the slack is out, and we're going to use a rotational movement where we look to one side. Now as I do that, I'll show you from the side here. If I wanted to do this one side at a time, I'd set myself up sideways with the band. What I'm doing is as I'm turning, I'm making sure that I'm not rounding. I'm making sure I'm not moving my head forward. My ear is still right above my shoulder, and I'm pulling my face towards the back of my head as I keep my neck tall, my spine tall. That decreases the pressure on my discs, allows the facet joints in the back of the neck to bear more of their normal pressure, and allows me to strengthen those muscles in a way that keeps my cervical discs less compressed with flexion. I can also do a lateral flexion maneuver where I'm tilting to one side. And when you do this, it's very important not to just crunch down and compress that neck. I'm moving my head up and over, so it's a very short motion which strengthens the lateral or side tilting flexor muscles of the neck. Again, I'm keeping my face pulled back into itself, my shoulder blades in their correct position as I do this movement. You can switch around and do the other side. If you have a tendency to lean your head to one side or to twist it to one side, you want to go into that side first and end going the opposite direction, because you always want to end any strengthening exercise of the neck in a corrective direction so it sets the posture more towards a normal position. Hey, if you like this video on neck strengthening exercises for cervical degenerative disc disease, feel free to subscribe to our channel. We have a lot of great videos out there for you. If you'd like to help me share this valuable information with others, give me a thumbs up below or a like. Questions or comments, write in. I'll do my best to answer them. If you're looking for a custom exercise program for your unique neck pain that's based on your unique body mechanics and posture, go to the painfreeandfit.com website. You can go to our neck healing exercise program there. It teaches you self-analysis of your body posture and mechanics, all the stretches, strengthening exercises, coordination exercises, postural corrections you'll need to help give your body a correct healing stimulus to improve your cervical degenerative disc pains. I hope this exercise helps with your chronic neck pain by using strengthening resistance band exercises with your unique RPI for cervical degenerative discs.